I'm Dr. Pacheco at Spring Creek Animal Hospital, and we're going to be talking about our dental procedures here today. The first part of the process when a pet comes in for the dental cleaning is the pre-anesthetic exam, and we do a thorough nose-to-tail examination, including listening to the heart and lungs and evaluating the teeth pre-operatively. So you can see this patient has a lot of dental tartar and some gingivitis, and so she is definitely in need of a thorough cleaning and exam. Once the patient is anesthetized, we're going to do a brief pre-cleaning exam to check for any teeth that might be missing or that might be loose and might need extra attention. In this dog, there's actually a couple of teeth that are missing. I can see right away there's a premolar here and a premolar here that are missing. She's missing a couple of lower incisors, which are these little small teeth in the front. This is important because those teeth could be just missing from birth, or they could have fallen out, or they could have broken off, and there could be pieces underneath the gums that we need to pay attention to. So we may need to take x-rays of the areas where there are missing teeth. After this brief exam, then our technician will actually go through and perform the first step of the dental cleaning, which is removal of the gross tartar accumulation on the teeth, and then also we'll do subgingival cleaning, which means cleaning of debris that's underneath the surface of the gums, which is critical. If we do not clean underneath the gums, we cannot actually stop or slow down periodontal disease. Completed the removal of the large tartar on the outside of the teeth on the crowns, and then we've also removed the subgingival tartar and polished the teeth, and now we're going to go through and chart. So you can see here these two teeth are somewhat crowded and pointing together. Malalignment is what we're seeing. This tooth is also slightly mobile, if you can see while I'm pushing on it. Zach, we have a mobility, grade 1 mobility on 101, and this one's even more mobile. We'll call that a grade 2 mobility on 201. Here we're actually seeing some evidence of pretty significant periodontal disease, where the gums have actually pulled away from the tooth. This is kind of interesting. You'll be able to see that this is a 2-rooted tooth, and my probe can go all the way under the tooth. Okay, so that's the point at which we say that tooth can probably no longer be saved, because food and debris, when the patient eats, can actually get up under the tooth. The additional treatment that this dog will require will be x-rays to verify the missing teeth, and then in all likelihood this patient will have 2 loose incisors that will need to be extracted, and then 1 2-rooted premolar that will need to be extracted because of advanced periodontal disease. If this periodontal disease was left untreated, infection in these areas could spread to the rest of the body. It's been shown that humans who have better oral health care actually live longer, and the same thing goes for our pets, because infections from the mouth can spread to other parts of the body, such as the liver, the kidneys, and the heart. We're seeing this is the canine tooth, and then right here there should be, where we don't see a tooth in the mouth. However, on the x-ray right here, we're seeing a fragment of a tooth that was broken off, and there's a piece of the tooth under the gums that we need to go in and extract that we would not have been able to detect had we not taken this x-ray. So here is the actual level of the bone in the, what they call the socket of, or the alveolus of this tooth. This bone level should actually go up to here. Because of the periodontal disease in this tooth, we're actually seeing bone loss, and that is irreversible, and that's another indication that this tooth needs to be extracted. Missing on that side, and then it's present on this side. Sometimes we'll even see it that it just never erupted, that it will actually be below the gums, and it can actually form a cyst in the bone, and we'll have to go in and remove that tooth. And then right here, there should actually be 6 of these little incisors down here, but there's one missing here and one missing here. So whenever we find anything abnormal on our x-rays that needs additional attention, the owners should not be concerned, because we're always going to give a courtesy call before we perform any procedures, notifying the client of the costs and risks and benefits of the procedure.